For tuning in. This is Mo Asari, part of the MPK program from the University of Toronto, and today we're going to go over TKEs, otherwise known as terminal knee extensions. Now, this is a great exercise to activate your VMO muscle group. Basically, it's the teardrop muscle of your quadriceps called vastus medialis obliquus, and what it'll do is it'll help with you gaining full access to knee extension. Now, this is super important when we're looking at triple extension activity, so extension through the foot, knee, and through the hip, as staying in a slightly bent or flexed knee position over prolonged periods of time actually do undue stress to the knee joint, can cause a whole host of problems. So this is going to give us overall improved quad strength and quad activity, along with getting back normal levels of knee hyperextension, which is typically about 5 degrees. So we'll take a look at this from a side view, from a back view, and also from a top-down view, so we can really take a look and dive into TKE exercises and how they should be done. All right, so from a top-down view, you can see that we have our anchor point for our elastic resistance at approximately knee level or knee height. Now, this is important as the band is also placed directly behind the knee that's being challenged, so that we can improve our overall quad strength. You can use adopt a split stance or a shoulder width apart stance, which you can see here. Client can step away from the anchor point in order to increase resistance and tension in the band. The client will work through constant knee extension in a controlled manner with a pause at the peak contraction. Externally rotating the leg will allow for internal rotation of the lower limb, the tibia, to allow for proper joint stacking. This is best programmed for higher reps. Again, building that mind-muscle connection to knee extension and activation of the VMO. All right, keep in mind, everyone, that the TKE exercise or terminal knee extension exercise is kind of like the cherry on top. Now, we should always be addressing hip and foot dysfunctions first and taking a look at those areas when someone does experience knee pain. But TKE is going to be a great way to really gain that capacity at the end range of motion, just helping the joint stack properly while building that development in quad activity and quad strength. So let's take a look at the back view and how TKE exercise looks from behind. So again, having our anchor point at knee height, placing the band directly behind the knee being challenged. And again, we can adopt either stance of split stance or shoulder width apart, keeping our key features, so not falling out of alignment. So we want the hip, the knee, and the foot to be in alignment there, with the center pressure being at the midfoot. Client is again going to do extensions in controlled manners, focus in on a nice peak contraction up top. As we step away from the anchor point, again, feeling more resistance due to the tension in the elastic band, which makes this a heavy favorite over any kind of pneumatic-based exercise. Side view, we can take a look at the extension that we're getting with TKEs and building that mind-muscle connection with each repetition. Again, getting away from the anchor point to increase resistance. Again, awesome in a prehab sense or in a rehab scenario. Seen it been used with athletes for conditioning purposes to build strength in and around the joint for stability, and again, gaining that little bit of access to knee hyperextension, which will help with overall athletic ability. Stay tuned for more videos.